Good morning, Dr. Babar. My blood pressure has been high for months, but I don't feel sick at all. Should I really be worried?
Let's take a look at your results together, Sarah. We'll figure this out. Good morning, Sarah. That's one of the most important questions anyone can ask. Millions of people have high blood pressure without feeling a single symptom. That's exactly why doctors call it the silent killer.
High blood pressure quietly damages your blood vessels day after day, often without causing any warning symptoms.
The good news is that, for many people, simple daily habits can make a meaningful difference and help protect the heart. Stay with me until the end of this video because the final recommendation is something many people overlook, yet it could make a real difference to your heart health. Before we discuss how to lower blood pressure, let's first understand what blood pressure actually is. Every second, your heart pumps blood through thousands of miles of blood vessels, delivering oxygen and nutrients to every part of your body. When your heart contracts, pressure inside your arteries rises. That's called your systolic blood pressure, the top number on your reading.
So even if I feel completely normal, my heart could still be under pressure?
Unfortunately, high blood pressure usually develops silently. Many people don't discover it until it has already affected their heart, brain, kidneys, or eyes.
That's frightening. Is there really anything I can do to lower my risk naturally?
There certainly is, Sarah. Let me show you.
Food is much more than fuel. Every healthy meal is an opportunity to support your heart and blood vessels.
Absolutely. The encouraging news is that many people can improve their blood pressure through consistent, science-backed lifestyle habits. Let's begin with the most important one, what you eat every day. A balanced diet rich in vegetables, fruits, whole grains, and lean proteins helps support healthier blood vessels and better long-term blood pressure control. Many people believe they have to follow a strict diet to control blood pressure. That's simply not true. The goal isn't to eat less, it's to eat smarter.
So I don't have to give up every food I enjoy?
Absolutely not. With our personalized plan, you'll still be able to savor your favorites in moderation. Exactly. Healthy eating isn't about punishment. It's about making better choices most of the time, not being perfect every single day.
Healthy meals nourish your blood vessels over time, helping them stay flexible and allowing blood to flow with less resistance.
But here's where many people make a costly mistake. They stop using the salt shaker, yet their blood pressure still doesn't improve. One of the healthiest eating patterns for people with high blood pressure is the DASH eating plan. It's not a crash diet, it's simply a balanced way of eating that supports your heart.
That actually sounds easier than I expected. I thought healthy eating would be much more complicated.
Healthy eating doesn't have to be expensive or complicated. Simple, fresh foods prepared at home are often some of the best choices you can make. When you consistently choose healthier foods, you're giving your blood vessels the nutrients they need to stay flexible and function more efficiently over time.
Right. Now here's something that surprises many of my patients. Most people think the salt shaker is the biggest problem, but the real source of excess sodium is often hiding.
Many foods that don't even taste salty can still contain surprisingly large amounts of sodium. That's why appearances can be misleading.
I never realized that. I always thought avoiding extra table salt was enough.
One of the simplest ways to reduce sodium is to fill your shopping cart with more fresh foods and fewer highly processed products.
Doctor, I already feel more confident because these changes seem realistic enough to start today.
In the next chapter, I'll reveal where nearly 80% of the sodium in the average diet actually comes from. And it's probably not where you think.
Sarah, let me ask you a question. If I asked you where most of the salt in your diet comes from, what would you say?
Okay.
Honestly, doctor, I'd probably say the salt shaker on my dining table.
That's exactly what most people believe, but it's one of the biggest misconceptions about high blood pressure. In reality, most of the sodium we eat doesn't come from the salt we add at home. Around 80% of the sodium people consume comes from processed and restaurant foods, not from the salt shaker itself. That's why reading food labels and choosing fresh foods is so important.
Well, I would never knew that.
I never knew that. I thought I was eating healthy just because I wasn't adding extra salt. You're not alone, Sarah. Sarah, here's another surprise. Some foods that taste perfectly normal may still contain an entire day's worth of sodium.
The best approach is not a sudden extreme change. It's building healthy habits that are safe, realistic, and sustainable for your body.
Doctor, I like that approach. It feels like something I can actually maintain.
Exactly, Sarah. Long-term consistency is what creates real results. We've covered two powerful nutrition strategies for lowering blood pressure, but the next strategy is something almost everyone can do, and research shows it can have a remarkable effect. Sarah, now we are moving to another powerful tool for controlling blood pressure: physical activity.
Doctor, does exercise really make that much difference for blood pressure?
Yes, Sarah, it absolutely does. Absolutely, Sarah. Your body is designed to move. Regular activity helps your heart become more efficient and helps your blood vessels respond better.
Thank you, doctor.
When you exercise regularly, your heart does not have to work as hard to move blood through your body, which can support healthier blood pressure levels.
And here's something important. You don't need to become an athlete. Even simple activities, when done consistently, can create meaningful changes.
Right, I can do that.
Many people think exercise only works if they spend hours in the gym, but that is one of the biggest misunderstandings about blood pressure and fitness.
So, doctor, does a simple walk actually count as exercise?
Well, Sarah, that's a common question. Absolutely, Sarah. Walking is one of the simplest and most effective forms of movement. The most important thing is consistency, not intensity.
A daily walk can improve circulation, support a healthier heart, and help your body manage blood pressure more effectively.
But there is one type of exercise that surprised many researchers because it may have an even stronger effect on blood pressure. Sarah, many people think only running or cycling helps blood pressure, but researchers have discovered another type of exercise that may be surprisingly effective. Really?
I've never heard of that. What kind of exercise is it?
It's a method focusing on It's called isometric exercise. Examples include a wall squat or a plank. Research suggests that regular isometric training may help improve blood vessel function and support healthier blood pressure over time when performed safely.
That sounds much easier than I expected.
Exactly. The best exercise is the one you can perform safely and consistently as part of your weekly routine. Sarah, here's something I tell every patient. You don't need the perfect workout. You need a routine you can actually stick with.
So even if I start with just a few minutes a day, that's still worth doing?
Absolutely. Consistency is key. Absolutely. Starting small is often the smartest approach. As your fitness improves, you can gradually increase your activity in a way that's comfortable and safe.
Yes, that makes sense.
Over weeks and months, regular physical activity helps your cardiovascular system become more efficient, allowing your heart to work with less effort during everyday activities.
We've covered healthy eating and exercise. But the next factor is something many people overlook, even though it can make a meaningful difference to blood pressure. Sarah, let's talk about another important factor that directly affects blood pressure: maintaining a healthy body weight.
Doctor,
If someone loses even a small amount of weight, can it really help their blood pressure? Yes. Research shows that even modest weight loss can support healthier blood pressure. You don't need dramatic changes. Steady, sustainable progress is what matters most.
As your body becomes healthier, your heart often doesn't have to work as hard to circulate blood, reducing stress on your cardiovascular system.
That makes me feel much better. I don't need to be perfect.
I just need to keep moving in the right direction.
Exactly, Sarah.
Small movements.
Sarah, one of the biggest mistakes people make is trying to lose weight too quickly. Fast results rarely last, but healthy habits often do.
so instead of looking for a quick fix, I should focus on habits I can continue for years?
Exactly, Sarah. Consistent habits are the key to lasting change. Exactly. Small improvements in nutrition, regular physical activity, and quality sleep often work better than extreme diets. The goal is progress, not perfection.
When healthy choices become part of your daily routine, they stop feeling like chores and start becoming your new normal.
We've talked about food, exercise, and weight. Next, let's talk about alcohol, smoking, and the hidden impact they can have. Sarah, now let's discuss two lifestyle habits that can quietly work against your heart health: smoking and excessive alcohol.
Okay, doctor, I understand. Doctor, I understand smoking is harmful.
I understand smoking is harmful, but does it really affect blood pressure that much? Yes, nicotine causes your blood vessels to narrow and your heart to work harder. Over time, smoking also damages the inner lining of your arteries, increasing the risk of heart attack and stroke.
I see.
Smoking doesn't just affect your lungs, it damages your blood vessels throughout your body, making it harder for blood to flow normally.
I didn't realize smoking could affect so many parts of the body.
That's why quitting smoking is one of the most powerful decisions you can make for your heart, your blood vessels, and your overall health.
Now let's talk about alcohol. Many people believe that because a small amount may be discussed in some heart health conversations, it must always be good for. Doctor,
Can drinking alcohol actually raise blood pressure?
Yes.
Yes, studies show heavy alcohol use significantly raises blood pressure.
Again.
Yes. Drinking alcohol regularly, especially in larger amounts, can increase blood pressure over time. It may also interfere with...
Reducing heavy alcohol intake can help decrease unnecessary stress on your heart and blood vessels, supporting healthier blood pressure over time.
Doctor, today's discussion has already changed the way I think about everyday habits.
And we're not finished yet. In the next section, we'll...
Sarah, many people focus on food and exercise, but they often forget one of the most powerful pillars of heart health: quality sleep.
Doctor, can poor sleep really affect my blood pressure even if I eat well and exercise?
Yes, Sarah, poor sleep can have a significant impact on blood pressure, regardless of other healthy habits.
Yes, when you regularly get too little sleep, your body stays in a more activated state. Over time, that can make it harder for your heart and blood vessels to recover and function at their best.
During healthy sleep, your cardiovascular system has an opportunity to recover. This nightly recovery plays an important role in supporting normal blood pressure.
I never realized that sleeping well could help protect my heart too.
It certainly can, Sarah. Healthy sleep is just as important as healthy food and regular exercise.
Sarah, some people sleep for 8 hours every night, yet they still wake up feeling exhausted. That can sometimes be a sign that something else is going on.
Doctor, how can someone sleep all night and still feel tired the next morning?
Well, Sarah, there are many potential causes for that. Tree sheds. One possible reason is obstructive sleep apnea. During sleep, the airway repeatedly becomes for short periods.
When this cycle happens many times during the night, it can place extra stress on your cardiovascular system and may contribute to high blood pressure over time. So if someone snores loudly, wakes up tired,
Or their partner notices breathing, they says pauses in breathing, they shouldn't ignore it?
Sarah, let's talk about something we all experience: stress. Many people ask me whether stress alone causes high blood pressure.
Doctor, whenever I'm stressed, I feel like my heart starts beating faster. Is that dangerous?
Well, let's take a look at your recent tests. That's a normal response. During stressful moments, your body releases hormones. Sarah, we can't eliminate every source of stress in life, but we can choose healthier ways to respond to it.
Doctor, what's the first step when life starts feeling overwhelming?
Well, Sarah, the most important thing is to take a breath and acknowledge your feelings. Start with simple habits: a daily walk, regular physical activity, spending time with family or friends, getting enough sleep.
Healthy routines don't have to be complicated. Small moments of movement, connection, and relaxation can become powerful habits when practiced consistently.
Before we continue, which healthy habit are you planning to start first? Walking, improving your diet, sleeping better, or reducing stress?
Blood pressure isn't just about diet and exercise.
Really? I always thought blood pressure was only about food and exercise.
Healthy habits are still the foundation. But spending time with supportive family members, good friends, or even caring for a...
For many people, a daily walk with a dog or spending time outdoors with loved ones naturally increases physical activity.
Doctor, it's amazing how many small daily habits can work together to support heart health. Exactly, Sarah. And there's one final...
Sarah, after making all these healthy lifestyle changes, the next question is obvious. What blood pressure number should you actually aim for?
Yes, doctor, sometimes I hear 140/90, and other times people talk about 130/80. It gets confusing.
That's a common confusion. Let me explain the difference. That's a great question. For many adults, today's medical guidelines generally recommend aiming for a blood pressure below 130/80.
Right.
Lowering blood pressure safely can reduce strain on your heart, brain, kidneys, and blood vessels, helping protect these organs over the long term.
And before we finish, there's one final message. Even if lifestyle changes don't lower your blood pressure enough, that doesn't mean you failed. Let's talk about medication protecting your heart. Sarah, sometimes people do everything right. They improve their diet, exercise regularly, sleep better, and still their blood pressure remains high. If that happens, it doesn't mean you failed.
Exactly.
Exactly. For many people, medication is simply another tool to protect the heart, brain, kidneys, and blood vessels.
Healthy habits.
The goal is not simply to achieve a number on a blood pressure monitor. The real goal is protecting your heart, your brain, your...
Doctor, today's discussion has given me confidence that small changes really can make a difference.
Dr. Babar, thank you. I came here feeling worried, but today I'm leaving with confidence, hope, and a clear plan to protect my heart.
Now I'd love to hear from you. Tell us in the comments, which healthy habit are you going to start today? Walking, eating healthier, or checking your blood pressure regularly?
If you enjoy evidence-based medical advice explained in simple language, subscribe to Health Journey. Join our growing community, and let's build healthier hearts and healthier lives together. Every healthy decision you make today is an investment in your future. One small healthy habit, repeated every single day, can transform your life.